Press.
Hi, this is group 6, and our pathogen is Bacillus anthracis. And we're part of group 6 with Vered, myself, Kimberly, Syra, Casey, and Valentina. We're part of microbiology 215 with Dr. Molescu.
The origins of Bacillus anthracis can be traced back to the ancient civilizations of Egypt, Greece, and Mesopotamia, with the first record of anthrax symptoms mentioned in the book of Exodus. It wasn't until 1850 that Pierre-Francois Reyer's use of microscopy allowed for the visualization of Bacillus anthracis in tissue samples of infected sheep. In 1863, Casimir de Vane would be among the first to observe the transmission of the bacteria. He discovered the same rod-shaped bodies in healthy sheep after inoculation with the blood of a diseased sheep. More than a decade later, German microbiologist Robert Koch would successfully cultivate Bacillus anthracis. He was able to closely study its life cycle and find that it contained dried spores that could remain dormant for years, finally finding an explanation for the reoccurrence of the disease in livestock that would graze dried fields. And finally, Louis Pasteur developed the first vaccine for anthrax. Robert Koch, also known as the father of microbiology, successfully isolated Bacillus anthracis in 1876. During one of his experiments, he inoculated a mouse with the blood of an anthrax-infected sheep. The following day, the mouse died, and Koch would continue his experiments, leading to the propagation of anthrax rods over many generations. His research would lead to the development of Koch postulates, which are criteria used to determine a causative relationship between a microbe and a pathogen. Louis Pasteur not only saved the wine and beer trades by way of pasteurization in France, but he also saved countless lives by revolutionizing our approach to infectious disease prevention. His experiments consisted of injecting 15 animals with live anthrax bacteria. With only half of the animals vaccinated, the other half had died. And with this, he paved the way for advancements in immunization.
Etiology. Bacillus anthracis spore can affect soil water while and are very resistant to the environmental condition. This condition can make livestock sick when they gauze on polluted soil. Initiate spore can grow for years. Grazing animals include sheep, goats, cattle, wild deer, and antelope are more likely to contract anthrax in summer and fall. Butchering, working with skin, and eating raw and undercooked meat can spread the virus to humans. Skin contact causes cutaneous anthrax, while inhaling or eating the spore causes inhalation or gastrointestinal anthrax. Life and cycle. Anthrax begins his life by sparing the spore. The spore can survive in oil, water, and animal products. Spore develop bacteria when consuming the vulnerable host. Fast-producing bacteria create poisons that cause sickness. After the host dies, bacteria spirulate, continuing the cycle. Portal of entry. Cutaneous anthrax arises when skin cuts, abrasions, or punctures allow germs in. Inhalation anthrax occurs when someone inhales aerosol spore into their respiratory system. Food or drinks contaminated with Bacillus anthracis can cause gastrointestinal anthrax. Route of transmission. Anthrax can expire through several channels, each corresponding to certain activities or exposure scenarios. Direct transmission. Anthrax bacteria can spread through contact with infected animals or animal products, live skin, or wool. Inhalation, breathing an aerosol spore in a slaughterhouse or tanneries where infected animal products are processed. Consuming infected meat, particularly raw and undercooking from deceased animals, can cause gastrointestinal anthrax. Environmental exposure occurs when the touch anthrax contaminates soil or water. Farming, hunting, or handling anthrax-infected items can expose people to the disease.
Sign and symptoms. Bacillus is a type of bacteria that can cause different signs and symptoms depending on the specific species. Common signs and symptoms of Bacillus infection can include fever, diarrhea, abdominal pain, and sometimes vomiting. In more severe cases, it can lead to skin infections or respiratory issues. It's essential to watch out for the symptoms and seek medical attention if you suspect a Bacillus infection. When it comes to treatments for Bacillus infections, antibiotics are usually the go-to solution. Doctors may prescribe specific antibiotics based on the type of Bacillus causing the infection. This medication is worked by targeting and killing the bacteria causing the infection. It's crucial to take the full course of antibiotics as prescribed by a healthcare provider to ensure the infection is fully treated. Surgical intervention in severe cases where the infection has complications like abscesses or deep tissue infections that don't respond well to antibiotics, surgery may be necessary. During surgery, the infected tissue is removed to prevent the spread of the infection and promote healing. Alongside antibiotics in surgery, supportive care plays a vital role in treating bacillus infections. This includes measures like staying hydrated, getting enough rest, and managing symptoms such as fever and pain. For skin infections caused by bacillus, proper wound care is essential. This involves keeping the affected area clean, applying any prescribed ointment or dressing, and following the healthcare provider instructions for care. Throughout the treatment process, doctors will closely monitor the infection's progress and the individual's response to treatment. Regular checkups and possibly blood tests may be necessary to ensure the infection is resolving.
Bacillus, the causative agent of anthrax, is a highly virulent bacterium capable of forming spores. These spores allow the bacterium to survive in harsh environmental conditions, making anthrax transmission a significant concern. Hand hygiene plays a critical role in disrupting the transmission cycle of anthrax spores. Soap and water are effective in physically disrupting the spore's structure, removing them from contaminated surfaces or skin. Antiseptic technique is crucial for maintaining sterile conditions and preventing environmental contamination, especially in laboratory settings. Precautions such as isolation measures and personal protective equipment help contain anthrax spread and prevent direct contact with spores. On my next slide, vaccination, specifically anthrax vaccine absorbed, or AVA, induces protective immunity against Bacillus anthracis antigens, offering long-term protection against anthrax infections in high-risk individuals.
In 1932, Japan sprayed anthrax on Chinese cities with use of an aircraft they tested on prisoners of war, and about 10,000 prisoners died from the experiments. After 9/11, letters were sent to the U.S. Senator offices and news media agencies, and the powder was placed and when open caused it to float in the room and be inhaled, which is the most serious form to inhibit the spore. 5 people died from the attack and many people were exposed. In cutaneous anthrax, the incubation period is 1 to 7 days from exposure. Inhalation anthrax, incubation is a week with an exposure in up to 2 months. GI anthrax, incubation period is 1 to 7 days. And injection anthrax is only reported in Northern Europe to date and only reported in heroin injecting drug users. Blood tests can measure exposure to anthrax by checking the antibodies to the bacteria. And skin swabs can be obtained by swabbing open sores and then gram stained and cultured. When viewing a chest scan, you can see the mediastinal whitening or pleural effusion, which is seen with inhalation anthrax. Vaccine is only advised for those who are at risk of contracting it, like lab workers, people who handle animals or animal products, and members of the U.S. military. It is a series of 5 shots over 18 months and an annual booster. Avoid using imported animal hides. Always only try to use goods from the U.S. or somewhere that has international veterinary certificates that show appropriate government inspection and vaccination of animals. Just last year, anthrax was reported in East and South Africa, so you should always check before you travel to your destination you may be going to that has any recent outbreaks.
Recording stop.